Good morning, good afternoon, good evening, dear friends. I welcome you, colleagues from all over the world who are actively participating in this seminar. I am Mercedes Mayor-Lasage, World President of OMEP, the World Organization for Early Childhood Education. Today, I have the pleasure to welcome you to the seminar, Understanding the Role and Influence of Non-State Actors in Early Childhood Education and Care. Since 2021, OMEP, together with the Right to Education Initiative, have proposed to explore and engage with the problem of privatization and ECC. Privatization of early childhood education is one of the main concerns of our organization, and that is why we took the initiative to place the issue at the center of our debates, reflections, and research. This process can reinforce the enormous inequalities in access to early childhood education. The lack of clear action and investment of states has determined the development of communitarian initiatives and the expansion of for-profit programs. This results in a stratification and rising inequalities in access to quality education based on the economic condition of each family. The consequence is that for many families and children, ECCE remains in practice as a privilege rather than a human right. We are actively involved in the realization of the Education 2030 agenda that raises the target 4.2, where states commit themselves to ensure that all girls and boys have access to quality early childhood care and development services and preschool education. In order to fulfill this target, working groups have been formed. Documents and declarations have been signed and published. We collaborate and advise governments and organizations dedicated to ECCE, and we work side by side with UNESCO and the UN system and urge advances in legal frameworks to guarantee the human rights of children from all around the world. In November 2021, OMEP developed a webinar with UNESCO addressing what's happening with ECCE in the world. Two important studies were presented. The Right to Pre-Primary Education, a global study by Roland Mahomet, and the impact of the COVID-19 in early childhood education in Asia Pacific and the Sub-Saharan Africa, insights from the result of Rapid Regional Personal Survey by Joshi Kaga. The main objective was to obtain a real diagnosis about inclusion in early childhood and pre-primary education as a human right with long-term education and development objectives in terms of governance and financing, legal framework, societal expectations, monitoring, and evaluation of early childhood development overall. On April, we developed the webinar ECCE and privatization towards inclusive access for all, with Matthias Urban, director of the Early Childhood Research Center at the Dublin City University. We discussed the conceptualization of the complex and diverse field of early childhood education and care and privatization in relation to the notion of education as a common good. The issue of privatization is not exhausted by differentiation private for public institutions or by studying the growth of the private sector over the years on what this means, but by focusing on the role of non-state actors in early childhood education and care, in the strengths and power that these have. Non-state actors lead care and education services for children under 3, and non-state provision of early childhood education and care services for children from age 3 up to school starting age also dominates the sector. The role of non-state actors extends well beyond schooling. They work with families, with communities, with children's subjectivities. So it is fundamental to know, in order to guarantee the full exercise of children and families' rights, that states can regulate their activities. Now we are participating in this seminar, understanding the role of and influence of non-state actors in early childhood care and education. OMEP and the Right to Education Initiative are grateful with Manos Antoninis and all the team of the GEM Report of UNESCO for their support for organizing and developing this webinar. Today, our panelists will address these issues through presenting the key findings and recommendations on early childhood education and care related to the UNESCO 2021-22 GEM Report on non-state actors in education and the GEM 2022 Gender Report to explore the role of non-state actors as providers, businesses, funders, and influencers. Our main presenter is Ana Cristina Dadio. She is an economist by background and has worked as a senior policy analyst in the GEM Report team at UNESCO since March 2017. Prior to this position, Ana worked at the Organization of Economic Cooperation and Development on a comprehensive list of issues ranging from financial education to literacy, inequality, poverty, the intergenerational transmission of education, again, aging, social protection, the life course approach to social policy, and the decline of fertility with a particular emphasis in the role of policies. We also have the collaboration of Alexandra Jovic, a UNICEF colleague and regional ECC expert. Alexandra Jovic is a medical doctor with more than 17 years of experience in social development. She is currently holding the post of an early childhood development specialist in UNICEF Europe and Central Asia Regional Office, tasked to support work in 22 countries to mainstream early childhood development principles in health, nutrition, education, child protection, and emergency planning and response. In her current role, she is managing development and deployment of several digital innovation aimed at improving access and quality of health and education services for young children and their parents. Finally, Delphine Dorsey will offer us the closing words. Delphine is a human rights lawyer with more than 10-year experience in the field of the right to education. She joined a Right to Education initiative in 2012 as legal and communication officer and has led the organization since 2014. She previously worked at UNESCO for the Right to Education program for 4 years, and she has also worked with a number of NGOs in Europe and Africa, including Amnesty International, Save the Children, Defense for Children International. She holds a master in human rights for the University of Strasbourg. We aim that the discussion of this webinar can contribute to explore how stronger regulation, monitoring, and governance efforts could prevent the emergence of parallel systems linked to the type of provider and parental ability to pay, and really help in achieving inclusive quality education and early childhood education and care and pre-primary education for all our children. The content of this webinar will feed our advocacy work and enrich the exchanges to take place this November in Uzbekistan in the UNESCO World Conference on Early Childhood Education and Care that we are taking part in the organization. This is the last webinar in the series for this part of the year. The next event will be the World Assembly and Conference of OMEP in Athens in July, to be held very, very close, to which I invite you and encourage to extend the invitation among your contacts and colleagues to seize the privilege to being able to meet face-to-face, luckily face-to-face again, and continue to advocate for children's rights and for early childhood education and care. As you may know, every webinar from OMEP Seminar Series is available in 3 languages, Spanish, French, and English in our YouTube channel, OMEP World TV, sorry. And so will be this one during this week, we will upload it. Thank you for joining. Well, first of all, we want to start this session watching a video about the GEM report in order to get a big picture about this important report and the work the GEM report team is doing that is very outstanding. Thank you.
We have close to around 12 million people entering the workforce every year. The skill development problem cannot be solved by the government alone or neither by the industry alone.
Many of them are school leavers, college leavers. They need jobs and they're ideally suitable for entry-level jobs. To train them and put them in jobs, all the partner stakeholders need to work together.
मैंने सोचा कि बहुत अच्छा मौका मिला है मुझे क्योंकि ये बिल्कुल फ्री है। ये मेरा फर्स्ट स्टेप है क्योंकि मेरा बचपन से ही सपना रहा है कि मैं डॉक्टर बनूं।
The choice of schools available to low-income families is not nearly as good as the choices available to those wealthier families.
The reality is that the choice of a world-class neighborhood school within safe walking distance of my home was snatched from me.
As education privatization increased, African American students were increasingly segregated into low-income and uniracial schools, due both to an increase in charter schools and to public school closures.
때부터 그런 혜택을 받았다고 할 수 있어요. 환경의 영향인 것 같아요. 본인이 욕심이 있고 또 어떻게 성취하고 싶은 목적이 있다면은 더 원하게 되는 경향이 생기는 것 같습니다. 이게 공교육이 꼭 부족해서라기보다는 여기서 좀 더 잘하고 싶다는 경쟁 의식.
A minha maior preocupação quando eu decidi me formar em recursos humanos utilizando o FIES já foi como eu pagaria. É muito assustador você ter ideia de que você está fazendo um curso para pagar ele depois de 2 anos ali no contrato, sendo que você não tem certeza de que você vai arrumar um emprego dali 2 anos.
Ndi mukyala muzadde nina abaana 6 nezigyayo sente netwala abaana ku masomero tebabeera nga basoma nga nze bwe nnoonya emirimu gye nkolakola okusobola okusasula sente z'okuzizzaayo.
Government of Uganda is not financing universal primary education or universal secondary education as it is supposed to. Education is a public good which government should try as much as possible to ensure that each and every person or child gets the opportunity to access.
We should be reimagining public education, having conversations in neighborhoods all over the country.
Daqui a alguns anos, eu espero realmente que no Brasil as pessoas que não tenham dinheiro para cursar em uma universidade privada ou para pagar o curso, ou realmente precisar investir muito em educação no Brasil, elas tenham mais acesso.
Thank you for this amazing video that gives us a panorama about the GEM report that I recommend to read and analyze strongly, really. Well, now we are willing to hear Ana Cristina Dario, our keynote speaker today. She will present the select findings and recommendation from the 2021-22 GEM report. Well, Anna, you have the floor. Thank you.
Thanks a lot. I hope you can see my screen and you can hear me well. Thanks a lot, Mercedes, and thanks to you all to be here. I'm very happy to present some of the main findings of our report, non-state actors in education, but really focused on the chapters on early childhood care and education. So the first thing that I would like to tell you is that by 2030, the number of children up to primary school entry age who will need childcare but lack access is expected to increase by 25 million in lower middle income countries. But the low enrollment in pre-primary education in these countries is linked to lack of supply rather than of demand. Many families are willing to pay for access to early childhood care and education services. And the gaps in public provision, in particular, have led to the entry of private providers, non-governmental organizations, faith-based organizations, and community groups. But what the report highlights, the GEM report 2021-22, highlights that a strong non-state role in ECC provision risks entrenching unequal access at disadvantaged groups' expenses. So we can see the first fact is that there has been a huge growth in non-state provision in early childhood care and education, both for children under age 3 and for children of pre-primary education age. In particular, non-state actors lead the care and education services for children under age 3. And we know how much this period is important in the infancy of child, and especially when they are very young. And there are different situations across countries. For instance, we know that in New Zealand, private institutions account for 99% of enrollment for children under age 3. And among them, the share of for-profit private-owned services has increased from 23% in 2002 to 41% in 2019, at the expense of community-owned services. In other high-income countries, like for instance, in the UK, in England, private companies accounted for 750,000 childcare places, or 46% of the total in 2019. In that year, the value of the childcare market was estimated at British pounds 6.7 billion, with private for-profit providers accounting for 82% of the total. As I was saying, this is a phenomenon, the growth of non-state provision is a phenomenon that interests all the ages from under age 3, but also for pre-primary education. And non-state provision, as you can see in the chart here, presented here, on average, increased from 28.5% in 2000 to 37% in 2019. And in Oceania, some countries have close to 100% of preschool students enrolled in non-state institutions. What is interesting to note, and what the report, the GEM report does, is that it uses a definition of non-state actors that is very broad. So when we talk about non-state actors, we talk about very different actors and institutions. So besides private actors that mainly have a profit motive, there are also other actors. There are non-governmental organizations, there are community that provide these services. And there are faith-based organizations and NGOs, for instance, that are the main providers in many countries. In Germany, for instance, 73% of enrollment was in private institutions in 2017. However, about 1/3 of providers for children under 3 were Catholic or Protestant church programs. But home-based services are also a major part of ECC provision in several countries. And in some, finally, also small-scale community-based childcare programs are also very important. So for instance, in Uganda, 7% of ECC centers are community-based. And in some countries, especially in Latin America, governments have embraced and developed such programs to leverage the potential of an integrated approach to care, education, health, and nutrition that really favor the development of children. So another important fact that we need to consider is that lack of supply and the fact that this gap is filled by non-state actors can impact equity and inclusion. So non-state provision, and this is something the report highlights, addresses demands mainly in urban areas. For instance, in the 3 urban regions of Ethiopia in 2019 and 20, the gross enrollment ratio in private kindergartens was really well above the national average, that was 10%. And you can see here the figures. In Addis Ababa, it was 104%. In Dire Dawa, it was 31%, and Harare, 45%. This also means that rural and poor children have much lower access to non-state provision. But in some cases, this means that they have not access at all, because in many cases, in lower, especially in low-income countries, in rural context, there is absolutely no supply of childcare. And so the supply of childcare in this context may be totally inexistent. At the same time, the non-state provision can also be the only option for poorer children in urban areas. And the report, the GEM report has highlighted, for instance, that in some slums in Nairobi, 94% of providers were private. Of course, we realize that this means that all this can have an important impact in terms of equity and inclusion, because the risk is that when it's private provision that leads on the provision of ECC, it may be also that the cost is high, leaving the most vulnerable disadvantage behind. It's also important to note that, and this is something that the gender report highlights, that women often pay the price for weak public provision of early childhood care and education. The GEM report showed that 57% of children aged 3 years were enrolled in private institutions in 33 high-income countries in 2018. And they were 46% in middle-income countries. At the same time, what we note, and the report has reported, is that in many countries there is still the idea that women should support the care and education of children, especially when they are very young. And these reflect unequal gender norms that exist everywhere. And even in Europe, women perform more than 3 times more unpaid work than men. And only 7% of the early childhood and care and educational workforce are men. And this means, of course, that it is important to talk about that, because this can also have an impact on the probability of women to take part in the labor market. And we know very well that the fact that there is a strong supply of provision of non-state actors with the affordability concerns have had huge concern in the COVID period, also because of the COVID pandemic. In some countries, and you see here the numbers, there are very few countries, laws require at least some employers to support or provide childcare for employees. However, once again, these norms may leave the most vulnerable behind, because of course work-based ECC is linked to formal employments, which account for only 30% of the employed in low and middle income countries. What the report has also looked at, what are the implications of the non-state presence in early childhood care and education on quality and on equity too. So first of all, there are implications for their presence in terms of the system quality. However, very often the quality of service provision is related to country context and policy environment rather than to the provider type. And for instance, in Brazil, the value of the infrastructure quality index was significantly higher in private contracted creche and preschool than in public ones. Yet, there are other things to note. First of all is that private educators in non-state institutions tend to be less prepared and trained and have fewer opportunities for professional development. For instance, in Ghana, even if private preschools had better facilities according to a review, only 8% of private, but 75% of public kindergarten teachers do the Ghana Education Service Training Program. So this shows a difference in the opportunities that are opened to educators in private compared to public ECC services. And often it's also true that for-profit institutions engage in deceptive business practices or provide low quality services, which is something that is really very important if we think as these ECC services as something that matter crucially for the development of kids. So the other thing that we have issue that we have analyzed in the report is that based on the information that we collected in the counter profiles, the peer, the profiles enhancing education review, we have analyzed the information based on legislation and policies, and what the result of this analysis has shown that regulations in general, but even more for early childhood education, have a weak focus on quality and equity. Very often, regulation have a focus on administrative requirements, like registration, approval, and licensing of non-state providers. However, it is much less the case that this regulation focuses either on the quality, so it means learning material, training of educators, or equity, so how to grant access to the most disadvantaged children, for instance. At the same time, there is an issue of governance that is important. Because in some cases, governance in early childhood education is fragmented. In some cases, it is with the ministries of social affairs or policies, and in other cases, with the ministries of education. So also the communication and transparency of process is really different from other educational levels. And it is also the case that due to this multiplicity of authority that intervene in these ECC services, non-state providers can also register as business and commercial entities in some countries, and so they are not under the same quality assurance mechanism that are required for education institutions. In only 162 countries out of 211 education system, Ministry of Education are responsible for assuring the quality of non-state ECC provision, while the effectiveness of this quality assurance is still very difficult to assess. And there are some examples, as you can see here. For instance, in Lusaka, Zambia, ECC centers must register through the city council commercial sectors, while in some countries like Cambodia, there are separate regulations and decrees for community preschool. Now, another thing, and I'm almost finished. What is something that I already mentioned in a previous slide is that very often it is really important to talk about the presence and the providers, because it speaks about the fees, it speaks about the cost, and only the analysis of the peer, these profiles, the information from the regulations has shown that only 79 countries explicitly regulate ECC fees. At the same time, governments often provide subsidies, grants, taxes, and incentives, such as startup funding or public land to encourage non-state provision. So there are incentives for non-state to establish their services. But the cost of non-state ECC is really too high for the poorest, for the most disadvantaged. So for instance, the example of Ghana is very speaking, because it shows that private provisions cost 6% of annual consumption for the richest and 17% for the poorest. And in Ethiopia, the equivalent are 4% and 20% 1%. So it also means that the generally higher cost of non-state early childhood education means that urban elites are overrepresented in these institutions. And in countries that provide little support to families for this kind of services, families have to make the difficult choice between paying for ECC services or foregoing a salary to care for children. And in the United States, for instance, parents spend about 42 billion US dollar on ECCE, while the federal, state, and local governments spend 34 billion. So a lower amount on what family spend. And to conclude on a more positive note, it's also true that non-state actors innovate and advocate for ECC. So some non-state providers target those who may be excluded from the formal ECC system. So for instance, in Slovenia, non-state actors push for inclusion of Roma children in preschool education and their smooth transition into primary school. And there are examples about this in many countries. But it's also important to acknowledge that influence of non-state actors in ECC is broader than direct delivery of services and extends to advertising of education entertainment and digital learning tools for the youngest children, which may have negative effect on their development too. But there are non-state actors in addition to NGOs and other faith-based organizations and charities, foundations, and other non-state actors that really play an important role in ECCA advocacy. So to conclude, I would conclude with some recommendations. So the fact that there is really this low focus on regulation on equity and inclusion means and really calls for a much broader focus of laws, policies, and programs on equity and inclusion for all providers. And this also means that governments should establish quality standards that apply to all state and non-state education institutions. But this also means that it's necessary to have this rule or standards implemented. It is not enough to have the principle in legislation or have policies that call for that. Their implementation need to be monitored. And this, it's important, therefore, to establish common monitoring and support processes that apply to all state and non-state institutions. And once again, there is no monopoly on good ideas, so it's important that innovation spread through education system for the common good. But it's also important to maintain the transparency and integrity of the public education policies process to block vested interests. Thanks a lot.
Thank you so much. Thank you so much for your presentation, dear Anna. And it was really an amazing synthesis about this dense and important report. And I want to stress these recommendations. The recommendation is we want to really to achieve the target 4.2, we must move, we must push our states in order to recognize early childhood education and care as a common good, as a responsibility of states, and the need of regulation, quality standards, monitoring, evaluating the systems. Thank you so much. Well, we have the company, the participation of many colleagues from all over the world. We have here, there are some colleagues that we love a lot and we appreciate a lot, as for For example, our vice presidents for OMEP vice president from Asia Pacific region, North America and the Caribbean region, Latin American region, our colleagues from Action Aid, Equal Education Law Center, EDUCO, Right to Education Initiative, our colleagues also from the GEM Report team. I especially want to say thank you to Kate Linkings. And we have also colleagues from all over the world, from Cuba, Fiji, Argentina, Cyprus, France, Japan, Paraguay, Australia, South Africa, Ecuador, Mexico, Poland, Croatia, Canada, Chile, Uruguay, Russia, Kenya, Peru, Ireland. With us is Matias Urban. Thank you, Matias, for coming in. Spain, Nigeria, Thailand, Pakistan, and India. Well, I really thank you all for being part of this important webinar. Now, I would want to introduce you to Alexandra Jovic, sorry, Alexander Jovic, and I am influenced with the tennis, you know, sorry, and I will ask it. I will want to ask you some questions in order to comment this report. The first one, we know that high costs of private provided ECCE, it's excluding the most marginalized for accessing services. Drawing on your own research, can you share any examples of government initiatives to enhance access to quality public early childhood education and care for the most vulnerable?
Thank you, Mercedes. I will try to mainly having in mind the perspective of Europe and Central Asia region as defined by UNICEF, where we have 22 countries, and in which governments are really trying to make an effort, particularly in the recent years, recognizing more and more importance of preschool education. Good country examples really include interventions at the levels of policy, quality, inclusiveness, diversification of provision and financing, and UNICEF is trying to support national authorities in all these endeavors to strengthen the systems, including through better financing, quality, workforce development, and so on and so forth. But in your question, what I hear are actually two questions. First is ensuring quality in public provision, and the second, ensuring access through more targeted approaches to ensure that the most vulnerable children are actually benefiting from quality services. To start with the first one, indeed, ensuring quality as public provision is key as the provision is expanding. And quality is an issue in majority of settings, especially in our region, this shift towards play-based, child-centered pedagogies. So a lot of investment is made into teacher training. We are working with 6 countries in the region to strengthen ECC teacher training through national learning passport continuous professional development platforms, using the advantage of this platform developed jointly with Microsoft that gives the free access for all the ECC teachers from a particular country. So these training resources are developed as a step-by-step guidance, as video examples and teaching and learning resources to help undertrained teachers in remote rural settings to still be able to provide a quality intervention, like is the case in Uzbekistan. Teacher training, what we see is that, particularly for unprivileged or, very poor and ethnic minority children, it is not only about access, it is about how is child treated and what is the perceived benefit of this preschool education. So teacher training and competencies for inclusive education are key for inclusion of minority children, but also for enrollment of children with disabilities. And again, we believe that these efforts of teacher training should bridge public and private provision with opportunities for teacher training and responsibility for teacher training being equally valid for both private and public providers. A good example here is Serbia, where a new modern preschool curriculum was rolled out by the Ministry of Education, but across both public and private providers in the context of ambitious preschool reform. Additionally, across the region, we see a momentum in developing national early childhood education and care quality frameworks that are aligned with the EU quality framework and either developed or being developed in Serbia, Cyprus, and Bulgaria. And we see these efforts as really promising in setting broader quality agenda and ensuring accountability for quality through setting appropriate indicators at both national and municipal level that are, again, should be applicable to all providers. The second part of the question really relates to how do we ensure access for the most vulnerable? And this continues to be the focus of our region as we see significantly lower enrollment rates for most marginalized and vulnerable children, though provision in our region is still dominated by public providers. And there are few countries that are, that are now increasing the provision by the non-state actors like Bosnia, Kazakhstan, Turkey. In majority of other countries, it is dominated by the public provision. We see that interventions of countries, governments, in terms of introducing at least 1 year of mandatory pre-primary education, increased enrollment rates among the most vulnerable children, not necessarily immediately enabling sufficient quality, but at least starting to decrease the gap in school readiness and facilitating inclusion before the basic education. We also have a few countries such as Armenia, Kosovo, that are good examples of diversifying modalities of provision and creating small rural pre-primary education units that are provided in partnership with local communities and that improve significantly access for children from remote and rural areas. Other examples of diversified provision include, traveling buses, small groups that are handled by, again, trained community providers, but that are provided in partnership and with the subsidies from the local governments and even central governments. We also have excellent examples of the partnerships with the grassroots NGOs that are representing minority communities, where they are really facilitating and building the trust between the public providers and parents of Roma children in our region most frequently, and that is helping to increase enrollment in Montenegro. In Moldova, an effort was made to really establish partnerships and map all Roma children that are out of the system who were then enrolled. And we also see a number of good financial incentives in which, particularly in the decentralized settings, we see that poor municipalities, if they have poor local governments, if they have the responsibility to fund preschool education, they tend to keep the poorest children out because they cannot pay on their behalf. So central transfers from the central government to the local level for the poorest children have managed to equalize to some extent access. So we also, acknowledging that the non-state actors and the private actors are carving their way, and that reaching the full coverage will be difficult without giving and acknowledging their role. So we are helping countries to develop a range of regulatory tools, such as Kazakhstan, and funding models that will allow them to ensure better access and quality by both public and non-state providers. And there are examples in which Serbia is one of them, in which providing vouchers to low-income parents, who can use them to access any type of provision, including private provision, has helped, again, increase the access and, decrease segregation. So I hope that I haven't spoken too much.
Thank you, Alexandra. Really very interesting comment. And yes, we are all concerned about the increase in the provision of increasing pre-primary private education and as a trend inside the system, and the connections, as you have stressed, between these trends and the quality of the system. Do you want to add some other idea, or we can go to?
I think that,
yes.
Yeah, I think that this report is very strong in recognizing actually key recommendations. And we see that the non-state actors have been more flexible, more dynamic in responding to the demand than state actors. And there is a huge responsibilities now on the government side on how to address this situation and how to manage both the relationship with the non-state actors and to enforce their regulatory role. So they are recognizing the potential of the providers, but we see the big differences in quality of provision, lack of standards and regulations, lack of oversight, even where regulations exist. So the space is there for the government intervention and oversight, and without that, as you are rightly saying, we believe that the curve will move only for the benefit of the children coming from more economically advantaged families. What is ideal is that public and private sector should work closely as a network of service providers that is regulated by state standards on quality and supported by the network of preschool inspectors. So we see that good examples come from environments in which non-state actors were involved in the planning processes with the government and considered as a modality for the expansion of access, in which governments have the primary role to really step up and ensure that children who are first to benefit, the most vulnerable one, have to be protected through regulation, through smart plans for the expansion of the ECC and incentives that will guarantee access to the quality provision for them, through application of the quality standards that will not be only structural, but also really cover the process, registration, licensing and inspection by public education authorities, and standards and incentives that support equity. Either higher incentives for setting provision in remote areas, quotas for enrollment of the poorest children, or voucher system that I have mentioned, that could be some of the ways in which equity should be more promoted and quality better regulated.
Thank you for your comments. Really, I think that children are more vulnerable than vulnerable, vulnerable in their rights. Where I am eager to hear the closing remarks that will be given by my dear colleague Delphine Dorsey, from the Executive Director of the Right to Education Initiative. Well, Delphine, you have the floor. And please speak slowly, because our interpreters will have a very difficult moment with you. I know you.
Thank you very much, Mercedes, and muchísimas gracias. Thank you very much for the translator, actually, and for OMEP for allowing so much inclusivity on this topic. We often tend to focus meetings in English, and I think knowing all the number of people joining this meeting today, it's a great achievement, and I think we should really do that more often. And I would like to say, you make the list, Mercedes, about all these people that join this discussion. Of course, from the partner at national level, including people from OMEP, but also I see our colleague working on the human rights side, discussing today with UNESCO and UNICEF on board. I think it shows how this topic is so important, how early childhood care education mobilized and is needed and is key. And this is why I think it was important to stress today how important is it to really finance this sector and to act. You stress that, Mercedes, and I really like it. Like, we need to act if we want to achieve SDG 4 target 2. And if we can acknowledge, like, there is a lack of supply and provision in early childhood care education from the public sector, and of course, like, in that sense, having private actors that are from different backgrounds. And I think Anna shows that well, like, they are not just for-profit actors. There are a lot of communities that mobilized and NGOs to provide support for child and to support as well the women. I think this is a key element. We cannot avoid that, and how they are burdened on women to take care of children, which create also inequalities in other area. I think what struck me in the presentation from the GEM report is how it costs much for the poor family. That's, I think, is the key figures. Like, they are the one who needs this even more, because often this family needs the support of the states and the institution to support the development of the child, and they are the one with less money and who have to pay the most, of course, in proportion. So I think this is something to remember. I think this is what brings us together, is to achieve that for everyone. Is we said, like, early childhood care education is so fundamental for the development of a child and for continuing his education. So we should all mobilize to achieve that, that guarantee inclusivity. And I think the example given about Serbia and some regulatory support are interesting and encouraging, and seeing UNICEF supporting the states in developing all this system. We know states need support, and they are much more to develop. Was very interesting the point Anna mentioned about the importance of not just having regulatory framework. It's not just about regulatory framework, it's about the content of the regulatory framework that is going to ensure equity and quality. And I think this is something important to have in mind. And I would say, one thing I point out, which I think is key, is about teacher and training teacher and how we should invest there, because we show, like, it's not because it's private education that is necessary better. And here we see some issue around the training of teacher. And this is key to accompany child at this age. I mean, it's not just about knowledge, it's how we are going to deal with their emotion and the specificity of their age. And so making sure we train properly teacher is key. And I would say to join what you stress very well, Mercedes, about moving towards SDG 4 and this target for 2030 and the need for regulation. And I think we are collectively trying to move that to strengthen the legal framework at national level. And we see, like, when they are get regulation for free pre-primary education, this have a better impact, and this is shown in the report UNESCO did, and you mentioned as well, Mercedes, on pre-primary education, and also, like, to move and strengthen the legal framework at international level for better accountability, and also to help to implement better at national level, and hoping for more effectiveness and enforcement through effective mechanisms that we show. This is one of the current a challenge. And maybe I will just close mentioning the Abidjan principle on the right to education that can provide guidance on developing this regulatory framework and dealing as well with the question of financing around early childhood care education when this involves public funding being given to a private actor. So I know my time is over. I maybe speak too much. I hope slow enough. Thanks, Mercedes, for flagging that. And it was very rich discussion, always very strong reference and background information from the GEM report. So thank you so much for being with us to gather reflection and thoughts and information as well on this key level of education. Thanks, Mercedes. Over to you. Sorry.
Thank you so much, Delphine, for your closing words. Thank you, Ana Cristina and Alessandra, for all the knowledge that you share with us this morning, and thank you to all our colleagues from all over the world. Thank you, Raji, for coming in also with us, being a part of a survey we are developing a very important survey. We invite you to participate in it about privatization and early childhood education and care. Well, we are on time. So we are closing this amazing webinar about understanding the role and influence of non-state actors in early childhood care and education. And we will upload it in the 3 languages during this week in the YouTube channel of OMEP World. Thank you so much. Have a nice day, afternoon, evening to all of you. Thank you. Bye-bye.